Hi there.
Hi there.
Welcome to our heart-to-heart discussion today. I'm Dr. Sarika Desai, and I'm a cardiologist here at Arizona Heart 360. I also teach at the University of Arizona College of Medicine, along with a professorship at the Southwest College of Naturopathic Medicine. I have found that a lot of my patients were seeking an alternative to traditional medical therapy. We had several patients here with Dr. Khoshaba that really were tired of having side effects from traditional therapy or wanted to have a discussion with a cardiologist as well as a naturopathic physician where we could come up with rather a collaborative approach. So I'm going to hand it over to my colleague here, Dr. Khoshaba, who I met many years ago, who's one of my closest friends, and we have really been awesome with our patients, I feel, in working to bring that integrative approach to them.
Hi there, I'm Dr. Linda Khoshaba. I'm a naturopathic physician focusing on natural endocrinology, and I've been practicing for about 7 years, and I've had the honor to meet Dr. Desai through the process only because people seek us out for natural health. They come in a lot of the time for hormonal problems, especially thyroid disorders, including Hashimoto's or adrenal disorders. And I found that with a natural and holistic approach, just because of the philosophy of naturopathic medicine is literally look at the entire person and treat the entire person. And in that approach, we do look at a lot of numbers, a lot of lab results. So we're looking for not just only thyroid markers or hormone markers, there's a lot of cardiac markers that I tend to see on there. Yeah. And it's, yes, we can treat the person, but I really want to have a collaborative approach with somebody on the conventional side of things. And I found that in practice, it's really difficult to have a conventional side versus naturopathic side. I always found that there's this barrier. It's this side or this side. And I always would get disappointed or discouraged or really wanting to just bridge that gap, because at the end of the day, it's not about your ego or my ego. At the end of the day, it's really caring for that patient and making sure that that patient is well. That's their interest is our interest, and the other way around too.
And Linda and I have found that a lot of our patients, we really believe they shouldn't feel torn between either the osteopathic medical world versus the naturopathic world. There's been criticism on both ends, but I feel that working together we have hundreds of patients together, they've appreciated our approach. We really don't, come down on each other's fields. We really support each other, and it may not be everything, but we certainly agree, and we try to take care of our patients in the best way that we can. Linda often finds elevated CRPs and other cardiac markers, and that often she wants to talk to me about how we can address their cardiac risk factors. And so, Linda, when you find that
exactly, it's not just their thyroid, those are maybe the underlying factors that could be driving a change in their hormone, or so I feel like we need to have this eye to eye. We need to have a good plan for our patients, and really have them feel comfortable. It's not just they have to choose between naturopathic or a conventional medicine, because oftentimes it's about the patient. They come in there and they're like, well, the cardiologist wants me to take this drug and you don't want me to take this. But at the same time, if we find a common ground and have that connection, and every treatment plan is very individualized. It's not just one medicine will treat everybody, but if you're really focused on that patient, whatever is best for that patient, you and I can have a conversation on, is this the best appropriate therapy for this patient?
Right.
And if it is, whether it's natural or whether it's a prescription medication, at least you and I can agree for the patient. And if the patient knows that two people are looking at it for them and we're talking about it for them, then they're going to be more compliant and they're going to follow through and they're going to get well. At the end of the day, that's the goal.
Yeah, we often have patients who really do have side effects that they're often told by their physicians that, well, you know what, that's all there is. Or in our traditional world, we often find that maybe you don't fit into that box. And just because you don't fit into that box or traditional algorithm doesn't mean that there isn't an option for you. And I think working with Dr. Khoshaba has really taught me that. I think that I was really, really stuck in a place where I had patients that maybe, for example, they couldn't tolerate side effects to statins, or they wanted to be considered for celery extract, juices and things like that that could really help with their hypertension. And I can probably go on for hundreds of examples, but working with Dr. Khoshaba has really taught me that we shouldn't really be labeling patients or making them feel that their side effects or their complaints are not respected. Every patient should be respected, and I think that we have to together, and we have been doing, find a really a holistic approach to all of this. And I've been really happy to do that with her, because we have had many success stories with our patients who feel like they've won the best of both worlds.
Yes, absolutely. When patients come in and they do have an underlying cardiac issue that I'm suspecting, and I need them to go see a cardiologist, they get fearful. Because they're afraid. They're thinking that if they come into your office, you're going to prescribe them a statin. For some reason, everyone assumes that when they come to see you, they're getting a statin. And there's a lot of fear with statins. And let me just say, like in a naturopathic field, that's not how we're taught in medicine. We're not taught to just symptomatically treat. We're really taught to treat the whole person and look at the underlying causes. And doctor is teacher, because a lot of these problems that we're faced with, especially heart disease, there's a lot of preventable causes. And the blessed thing with the naturopathic philosophy is that we actually can spend time with the patient. We actually can educate them, trying to teach them how to get their lifestyle. Because if you can get your lifestyle in check and just motivate them to eat right, and what to eat and how to eat it, and the exercises and everything else that comes with it, when you can educate someone like that, then they're going to follow through and they can reverse that. So that's where we come into play. But there's other people, there's a lot of conditions like genetics. There's an underlying genetic problem that no matter what, if I tell them go train for the Boston Marathon, it's not going to lower their cholesterol. So it's those types of people that are extremely at high risk that don't even know it. And those are the ones that I call them my ticking time bombs, and really my heart goes out for them. Those are the ones I send to you immediately, because I know that once they hear it from me, and I just encourage them, you got to go see the cardiologist. They're going to be in your hands. They feel safe. They feel nurtured.
And my patients as well have been very grateful for that combined approach. I think one of the compliments I always hear is that she always says that she respects you, and likewise. And so I think we're both very happy to hear that from our patients, because at the end of the day, everything that she and I do is for them. And I think that combining the modalities, it really, really achieves that. I think, as Dr. Khoshaba mentioned earlier, one of our biggest issues that we both come across are elevated lipoprotein levels or elevated cholesterol levels. I think diet, education, lifestyle changes are what naturopathic community has been screaming for decades, and what we are definitely should be spending more time with our patients about.
We've been working with each other for so long, and I just think that we had this aha moment where I was like, why don't we just make this video for our patients or for other patients out there, so you don't feel discouraged that your providers are not talking with each other. There are doctors out there, so I want you to go out there and seek doctors that are willing to work with other conventional medicine or allopathic medicine or naturopathic medicine, and bridging the gap, because you want to find providers that are on your team, because at the end of the day, it's your health. And if you're on top of your health and you choose those providers, you're going to get those outcomes, because people like us are really going to fight for that and really want that for you.
Yeah, Dr. Khoshaba and I believe in both being advocates for our patients, and that's what drives both of us in our care. So we hope that you find like-minded physicians as well, and if not, we are always here to help you.